Hi, and welcome back to Health Focus. We'll turn right to our guest, Dr. Syed Amiry. Welcome to Health Focus, Dr. Amiry. You are a leading dermatologist with an area of concentration called cosmetic dermatology, and that's what we're going to start to talk about. But before we do that, tell us a little bit about your medical background and what brought you to this specialty.
Sure. As you know, I'm a cosmetic dermatologist, and I actually started medical school in Missouri. And then afterwards, I went to Pennsylvania to do my residency at Geisinger Medical Center. After residency, I felt like there was more of a need for doing more cosmetic procedures because I really enjoyed that. And so I went to San Diego and La Jolla, and I trained there in laser and cosmetic surgery. And then afterwards, I went to Los Angeles to work with Murad Medical Group. A lot of people actually have heard of him. For about 8 months or so, and then I moved to this area to open my own practice.
And you talk in some of the information that you sent us about your absolute care of each individual patient that you see.
Sure.
While you may see as many as 100 a week, your own philosophy is a dedication to each and every single patient, which is, I know how many doctors feel, but it's nice to see that expressed. So your area that has drawn you is cosmetic dermatology. Tell us what that means.
Cosmetic dermatology is combined of two terms. I do general dermatology, which is taking care of skin rashes, acne, rosacea, skin cancer, any lumps and bumps. But also, in addition, I also perform a lot of cosmetic procedures.
And you are the surgeon.
And I'm the surgeon, yeah. My main area has been actually lasers, but I also do a lot of fillers, liposuction, and one of the new machines that's primarily for cellulite and localized areas of fat. So I also use that as well.
And when we started the program, as Dr. Pinar said, Body Beautiful might have been a little flip. You see patients whose needs are critical, and those would include rosacea, melanomas, skin cancers, and so that's a big part of your practice too.
It certainly is. And the other thing I want to say is this: the reason I got into cosmetic dermatology, and just as opposed to just regular dermatology, for some reason it's a lot more rewarding, and that is, I think maybe that it makes such a great difference in people's lives, and that's why I really got into it. And I think, like when I do a procedure, I can't wait to see the expression on somebody's faces, because it really, the perception is that cosmetic procedures is about vanity. It's not about vanity. It really changed people's lives forever. It's about confidence. It's feeling better. And that's the rewarding part for me.
Well, and it's wonderful to hear you say that too, because as a potential client or patient of yours, it isn't about being more youthful. It is about care of how you look and deep pride in that. So let's talk a little bit about, let me just refer to some notes, because let's talk about cellulite and radio frequency.
Yeah, it's one of the main problems that a lot of women are affected by. Radio frequency is a device that treats cellulite. First of all, I want to say there isn't really an effective treatment for cellulite on the market. So
this is just the cross to bear for many women, and not all of them have cellulite, but those that do have deep concerns.
Yeah, and so this is probably the best we've gotten so far, and I think it really does an amazing job. But also, things come up like, do creams really work for cellulite? Well, I think anything we do is temporary, so they may work for a year or maybe 2 years. As far as creams are concerned, the things to think about is how deep do they really get into the skin? It's very hard to get it deep underneath the skin to produce its effects. So radio frequency is one of the most effective devices that I've used for cellulite so far.
And new techniques are always being made available too, and that's why a visit to you can dispel some myths and also talk about treatment.